obviously it wasn't. Anyway, I'm here to talk to you about the different aspects about optimizing children's health in the Western world where we live. You change the slide, please. We don't have a remote here. We have to do it manually. Change the slide, please. Okay, great. I can't see. Okay, so this is what I plan to talk about. So we want to talk about healthy and unhealthy children, so that we can work out how to keep them healthier. We're going to talk about causes of mortality and morbidity, which is illness, and a little bit on how we can prevent or reduce illness. And then I want to talk about safeguarding children a little bit, if we have time, because we kind of started late already, and obviously we have to finish by Salah time, so we'll see how the time goes. If you have any burning questions, please put your hands up. But otherwise, I can answer questions at the end. Next slide, please. So what I talk to you about is mostly well-established knowledge or peer-reviewed scientific literature from large established data collection from reputable sources. Of course, some of it is my own experience and my opinion, but I'll try and tell you which bits are my opinion, because I don't want you to go away thinking everything I say is gospel here. Next slide, please. So, what is healthy? Healthy children, one definition is being free from illness. And I want to talk about different aspects of health, so not just the physical health, which is what we seem to always concentrate on, but there is also the emotional, and we would perhaps attach spiritual health to that, developmental health, and that's your cognitive development, your intellect, and also being safe, clean, secure, and confident and happy are all part of our health. So that's my definition of a healthy child. Next slide, please. So, firstly, just want to talk about what goes on around the world. Now, there's a few figures just to set the pace, really. The global measure of child health is mortality, because you look at children around the world average of infant mortality or childhood mortality rate is 5.7%. We normally look at them in figures in how many per 1,000, so that would be 57 in 1,000, but 5.7%, and that's down from 1990 from 8.8%, because it used to be 12.5 million, and we're down to 7.6 million, so that's really good. The target of the Millennium Developmental Goal 4 is to get it down by 2/3 from 1990 to 2015, which is the target would be 4 million. So we're probably not going to get there, because we're down to 7.6 million, but we've only got another 3 years to go to get it down to 4 million. So we're probably not going to meet that target. But it's quite sobering to think that most of these children, and can we have the next slide, please? Most of these children are dying from hunger and from infection. So, one child dies every 5 seconds because of hunger. You can read that. And that accounts for 60% of child deaths in the world. And then another big group are the ones who die from infection. So it's diarrhea and malaria and measles. So it's not big science here. It's simple stuff. Just giving children clean water and immunizing them would probably save them all, in the world. Next slide, please. But here we are talking about the children in the UK, so it's different. So we're only 0.5%, when the average was at least 10 times more than that. And that kind of ranges in the world. Can you imagine it in Afghanistan, where one of the highest rates of childhood mortality is about 20%, and then places like Iceland and Japan, one of the lowest rates, where it's it's only 0.1% or even less than that. So in Britain, we have one of the highest infant and childhood mortality rates in the Europe, and that's 5,000 altogether, and a lot of them are under 1 year. So they're either from prematurity, from congenital causes, either they've been born with a problem, they can't breathe, or their heart's wrong, or from birth asphyxia when they get stuck on their way out and deprived of oxygen. And these are the other 4 main causes of death in children. Cancer is the biggest now in the UK, followed closely by accidents, so road traffic accidents or poisonings. Hopefully most of them are accidental. And then another big cause is still congenital causes, so children who are born with either genetic causes or other sort of inherited causes. And infection is still one of the leading causes of death in the UK. Next slide, please. So compare this to the early 1900s. It's very similar sort of death rates to what we have in Africa and the rest of the world, where there were 200,000 children died a year. Now it's only 5,000. And the average 5-year-old only had a 40% chance of survival. And now most of them survive. So what are we on about? What are we here to talk about? It's actually, next slide please, is about morbidity, illness, because that's what I'm here to talk about, aren't I? About what makes children ill. And because most of the physical illnesses are prevented through vaccination, and because we've improved our nutrition and sanitation, we don't have to worry about, most of our children are immunized, we have clean water, we have access to food. No one dies of hunger in this country. So what makes children ill are these causes here. Bottom of the slide is missing for some reason, but at the bottom it says mental illness. So allergy is at the top. So asthma is one of the main causes of illness in this country. And then accidents, as I said, injuries and road traffic accidents, poisonings, infections, obesity and mental illness are big causes of morbidity in this country. I'm not sure if it's because it's not high enough. We're missing out the bottom bit, is it not? It's just not off the slide, okay. All right, mental illness is on the bottom of that list. So the government policies in this country that aim to improve children's health focus on quality of life, emotional well-being, and lifestyle issues. So the key policies in Britain are, you may have heard these names, the National Child Health Promotion Programme, the National Service Framework, and this document called Every Child Matters. I think Kumail must have put this little figure on the internet where he's advertised his talk today of these 5 children with wearing different T-shirts, and each one of them has each of these statements on them. So being healthy, stay safe, enjoy and achieve, make a positive contribution and achieve economic well-being. So these are the 5 things that Every Child Matters, this government policy aims to achieve in every child, or every child has the right to achieve all these 5 things. Next slide, please. So the Healthy Child Programme in the United Kingdom, it's all about trying to prevent disease or prevent illness, and so to try and get people to intervene early. Because if there's a problem, you intervene early, you start help earlier, then hopefully you can control things, you can make things better. Early identification of problems. So a lot of it will involve health developmental reviews. So the emphasis is on trying to get health visitors or GPs to try and pick up on problems right, from an early stage, screening for problems, optimizing on immunization, and making sure services are available, because some people are not aware of various services that are available in the NHS, and that's part of the problem, that people don't access them. So part of the Healthy Child Programme is to try and improve this. And then, to try and ensure environments that promote health and also give support for parents and carers. And the key health priorities are, if we have the next slide, please, and that lists all the things that I've kind of alluded to already, that in this country, these are the main health priorities for children. So, when we were talking about malnutrition in the third world, over here it's overnutrition. Children aren't moving enough, so they're getting obese. Child mental health is a really big growing problem, and we're going to talk a little bit about it later. And injury and accident prevention, really, I'm not going to say much about this because it's, a lot of work has gone into, 50 years ago, no one wore seat belts. There's lots of regulations on keeping various poisonous things safe and not to try and prevent accidents. So that's reduced the number of deaths and associated morbidity as well. Developmental disorders, that's children who are having problems achieving their either intellectual or physical abilities. The other two health priorities amongst children, unfortunately, is dealing with drug and alcohol and smoking, because it seems that even though there's so much negative press about smoking and drugs, and maybe not so much about alcohol, because it is still a drug, the rates of children who are smoking is still rising. And of course, there is this issue of teenage pregnancies and sexual health, because Britain, unfortunately, still has one of the highest rates of teenage pregnancies in the Western world. Next slide, please. This is my pet little... always, everyone who knows me knows I keep banging on about nutrition and fitness, because it's such an easy way to address our health. But this is what we're trying to do, to try and stop this obesity problem from escalating. So what's happening is breastfeeding is being promoted, because breastfed babies go on to have a reduced risk of developing obesity, so it's good. Delayed weaning, and when I say delayed, I don't mean mothers in the audience will know that these days their advice is to delay introduction of solid foods to at least 4 months, and sometimes 6 months. So delayed means no earlier than 4 months, because if you start solids in a younger baby, then that actually increases risk of obesity as well. Healthy diet, that's obvious, isn't it? What's a healthy diet? It's the one that's not overly high in calories, and that it's balanced, that it has not too much fat, enough carbohydrate for energy, and enough protein to grow, and that contains fiber and minerals and vitamins. So that's a healthy diet. And of course, avoiding processed foods, because all the ready-made foods that are now taking over the aisles in Tesco and all the other shops, these people don't cook anymore because they're buying ready-made food. People don't have time to cook. But the problem is with all these processed ready-made foods, they're just so high in sugar and salt and all the things that are not good for you. So the other aspect of nutrition and fitness is about encouraging an active lifestyle. The reason why people are getting more obese is not actually because they're increasing the calories they were taking. If you look at children's calorie intake now compared to 50 years ago, it's actually not dissimilar. But the problem is people are not moving enough. People are relying on cars. People don't walk anymore. People are scared to let their kids play out in the streets for various reasons. So children are just not as active as they used to be, and it's the same with the adults as well. So the whole idea behind various government policies is to try to, you've seen the adverts on television about trying to encourage people to keep active, but also identifying at-risk families, because bigger parents will usually have bigger children. And then some of you may have heard of the MEND program, which is mind and nutrition. I can't remember now what the acronym stands for. We use these terms so often, but it's to mend your body, to try and get you to be more fit. And there are lots of programs for big, for obese children, overweight children, down to age two and upwards. There are programs so you can get onto these just to kind of help you kickstart into being active. Next slide, please. So I've already talked a little bit about obesity, but these are just a few figures because I like statistics. So can you believe it? 30% of children in the UK are either obese or overweight. Slightly more boys than girls. And look at the figure from 1995. So it is increasing. And why is it a bad thing? Well, you know this. Increases your risk for getting diabetes, high blood pressure, cardiovascular disease, some cancers, and liver disease. And unfortunately, it's becoming the norm. That people's average size is just growing, and it is, I always bring cost into the issue because it is a limited source. We have limited resources in the NHS, but it is, it costs a lot to look after obese people and their associated morbidities. Next slide, please. So mental health. Again, it might shock some of you to know that 10% of 5 to 15-year-olds have some sort of identifiable mental health problem. And most of them are these, anxiety, depression. Children do get depressed. I've seen children as young as 4 or 5 with depression. Yeah, extreme behavioral problems, hyperactivity. You all would have heard of ADHD, which is what hyperactivity and attention deficit disorder is short for. Autism. These other problems right at the bottom, like schizophrenia and sort of psychosis. Again, you may have heard of these conditions. They're not so common in children. Unfortunately, things like eating disorders and in children who harm themselves, that is unfortunately becoming more and more common. There are risk factors associated with mental health. Parental risk factors, some risk factors associated with the child, and some with a household. So, for instance, if a mom has taking alcohol or drugs, including cigarette smoking, her child is at risk of developing mental health problems. Parents who are in unemployment, who are stressed, who come from low-income households, they're at risk of having children with mental health problems. Children who are born extremely low birth weight as well, they also have an increased risk of developing mental health problems. Of course, children who've been abused or looked after children who've been adopted or fostered, children who've had adverse experiences, who've gone through the result of their parents being separated or divorced, they have an increased risk. And I've mentioned the household ones as well. Next slide. So, aside from the risk factors I've just discussed, why are mental health problems increasing in children? Part of probably what I think, and I'm sure some of you may think as well, is we're just more aware of it. Where now that we've fought the bugs, the children don't die of infection. There is more of an emphasis on well-being and being happy, and so there is an increased diagnosis. People are more aware of mental health problems. Maybe part of it is a medicalization of normal symptoms. Maybe we're joining the Americans where everyone has a shrink because it's normal to talk to your psychiatrist about your problems. Maybe that part of it is that. So some studies have suggested that we're prolonging this transition from being a child to an adult. 50 years ago, people used to grow up, get a job, have children, and their responsibility increased much quicker, and they kind of got on with life and had to deal with various things. Now, people are spending a longer time. Young people are spending a longer time in learning, and there is a suggestion that this has increased the risk of mental health problems. And then these other things. Again, this is not my opinion, although I do agree with some of it. This is from established research, is that there is some increased peer pressure fueled by some of these networking websites. People are always young people are comparing themselves with other young people and say, well, I don't have that, therefore I'm not happy because I'm not the same as whoever. And, unfortunately, we're surrounded by this celebrity culture where everyone wants to be like whichever celebrity, and that in itself makes people unhappy. And of course, alcohol and drugs always has to play a part in that. What I thought was interesting is this, there's a suggestion that childhood is being undermined by school pressures. And, maybe some of it is. I know increasingly that a high incidence of young girls and boys with eating disorders who come from very high-pressured, high-performing sort of backgrounds, where they have increased pressures to perform well academically and related fields, where they feel they can't keep up with what their expectations their parents have, and they have an increased risk of developing mental health problems. And of course, consumerism and materialism doesn't help when everyone's desire is to have more and to see, to be able to have as much as everyone else has or get more. Then, of course, if you don't achieve that, then people won't be happy with that. Next slide, please. So, developmental delays and disorders, this is encompassing a big group of children. 20% of the childhood population have some sort of developmental delay. So it's either motor delay, where there's problems with either walking, doing things physically with hands and feet, so delay in that area, or delay in speech is a very common speech and language development, delay in those sort of things, and other areas are development of social skills like toileting and things like that. So there are a lot. Some of them are mild. Most of them are mild. I say 20%, because most of them are mild delays. But some of them are significantly higher, and those are the ones that are related to some brain insult, whether it was birth trauma or some congenital defect or infection. But generally, the bigger group of these speech and language difficulties, are usually the highest risk is the teenage parents and parents with learning difficulties, because parents with learning difficulties, unfortunately, then will have a higher risk of having their children also with learning difficulties. Next slide, please. So how can we prevent developmental disorders? Well, hopefully if we identify high-risk groups, and that's where government policies come in, this early support for high-risk children, including premature infants, children that are going to be at high risk because they've had a difficult birth, their brains have been deprived of oxygen at birth, children with metabolic problems, the children that you may see as the disabled children. If we know that children are going to have a high risk of developing development problem, then they are seen right from the word go to support them and try and optimize the development. In terms of the bigger group, which is the ones that you don't know about and they come up later on, ensuring good nutrition is always obviously a good idea, and especially in regards to iron intake. There's been a lot of studies showing that even a mild iron deficiency causing an anemia can cause intellectual acquisition lower compared to if you weren't iron deficient. And I know I mentioned this because the most common reason for seeing iron deficiency in young children is that they drink too much milk. And I know a lot of Asians tend to rely on milk for children as a food substitute, because as long as they're drinking milk, it's okay. But actually, milk doesn't contain much iron. So, if children who just drink milk, a litre of milk but no food, milk is for the under 6 months old. Once you're older than that, milk is not enough. And a lot of children, I've seen children, you might all know, normal hemoglobin is for a child, about between 10 and 12. for an adult, about 12 to 14. And I've seen children drink their way down to hemoglobin of 3 just from drinking milk. So it is really common cause for iron deficiency. And having a low iron and being anemic can affect your development. So it's a really important but easy preventable cause. These are obvious things. Reading to your children from an early age, avoid excess TV watching. Children are being bombarded with the television and various other screen-related games. And there is a lot of evidence that children who watch more than 1 or 2 hours or spend more than 1 or 2 hours on a computer or in front of a screen, that they don't do so well academically, but also even socially. So identifying hearing losses, visual losses, obvious stuff. And of course, for carers and parents, you need to know what's normal. And most of us know what's normal. If you have a second child, you know what's normal because you've had a first one. We live in a quite close knit society, so we have grandparents, we have parents around, we have people who can support you, young parents, through knowing what's normal and what isn't. But a lot of people who live in this country live very isolated lives. There are a lot of young parents who live here who don't have this support, so they don't know what's normal. So you need to know what's normal to be able to identify what's abnormal and then seek help. Next slide, please. So this asthma and allergy. I mentioned earlier on that asthma is one of the most common reasons why children get ill. There's over 1 million sufferers of just children with asthma, and it's the leading cause of admissions to hospital. So I'm working this weekend, and we will, most of the admissions that will come through to the children's ward will be either asthma or respiratory illness related. And the incidence of asthma and allergy is increasing. And I'm sure anecdotally you will have been aware of this. And you may have heard about the hygiene hypothesis. We're getting all too clean. Our bodies are too busy. Our bodies are not busy fighting infections as their bodies in Africa are doing. So children who die of diarrhea or children who get lots of diarrhea don't get asthma, they don't get allergy, because they're busy fighting parasitic infections. So there is an imbalance in the immune system, sort of simplistically, because the immune system's not busy fighting worms. It's now turning on itself and reacting unnecessarily against things that you shouldn't react. That's what allergy is, mounting a response against something that isn't abnormal, like pollen or dust mite. So the risk factors for asthma are obviously having a family history, because there's a genetic component. Premature children are more likely to have asthma and allergy. Being exposed to smoking, even prenatally, so even in pregnancy, being exposed to smoke, and of course postnatally as well. And an early particular virus called rhinovirus that gives you the common cold, that's also shown to be associated with an increased risk of developing asthma. And of course, if you have other related conditions like hay fever or eczema, that can obviously increase your risk as well. So it's a big thing, asthma and allergy. There's still 12 deaths, and that's children, a year. Yeah, that's a lot. You don't expect that, do you, in this day and age? But so it's a growing problem, and the NHS does spend a similar amount on asthma to not as much as obesity. Next slide, please. So I've already alluded to the prevention of allergy because we've talked about risk factors. So non-allergic parents obviously are going to have a reduced risk of having babies or children with allergy. Again, I've talked about pregnancy or postnatal tobacco, smoking exposure. Mothers who have eaten higher amounts of fruit, vegetable, and especially vitamin D, have been shown to have children with a lower incidence of allergy. So that's quite interesting. But no avoidance of allergenic foods. About 10, 15 years ago, there was a big study showing that if you ate peanuts in pregnancy, you'd increase your risk of having peanut allergy. So people then stopped eating nuts altogether in pregnancy. But actually, a lot more studies have been done since then. And actually, if you avoid foods, then that's been shown actually to increase your sensitization and increase your risk of allergy. So don't avoid eating anything during pregnancy. Just eat a healthy diet. Breastfeeding reduces your risk of allergy, so that's a good thing. Don't delay in weaning. Earlier on, I said don't wean too early, but also don't wean too late. So between 4 and 6 months is a good time. You might have heard of probiotics and prebiotics. Probiotics, things like Actimel that you can buy that contain lactobacillus and a couple of bacteria that have shown to increase the flora, the good bugs in your body, and those have been shown to also reduce your risk of allergy. Prebiotics, not the probiotics, are the ones that it gives you a substrate, so it contains like a sugar, and that increases your diversity of bacteria. So having just one or two bacteria from the probiotics is not good enough. It's having the prebiotics. This definitely reduces your risk of allergy. And funnily enough, drinking unpasteurized milk and living on a farm is also good for you, because children who live on a farm and drink unpasteurized milk have a reduced risk of allergy. So it's all turning around now. First it was all about getting clean and killing all the bacteria, and now these children, unfortunately, are increased risk of allergy. So get dirty again. Next slide, please. So in summary of what we're talking about in morbidity, how do we reduce our illnesses? You can start from before conception, where if there is a risk of a genetic disease in our society, there's Southeast Asians have increased risk of carrying the thalassemia gene. So there's some places. I got married in Africa, and we all had to have a thalassemia test so that you know who you were marrying, so that you know your increased risk. Because if you have 2 carriers, then you have 25% risk of having a child with thalassemia. So being aware, and I think they do this in the Mediterranean, where they also have a high carrier rate of carrying thalassemia as well. Having good antenatal care and healthy eating. So all this stuff in pregnancy will hopefully help to reduce morbidity. Neonatal, breastfeeding, avoiding tobacco, I've said this already. In infancy, of course, immunization, healthy food, accident prevention, all these things, obviously, next slide please, will try and reduce our risk. And then in childhood, let them play and be children, so that they can run around, have increased amounts of physical activity, reduce computer time, because that's not going to be good for you. And then, I alluded to this mental health issues with teenagers and adolescents. Giving them early responsibility obviously seems like a good idea. And I think optimizing spiritual well-being, because if you're happy and content with yourself through your spiritual awareness and being content that way, then hopefully that will reduce your risk of developing mental health problems. I put this next one in brackets because I do think that some children are under unnecessary pressure academically, even in our society, in our community. So, that's my opinion. So it's not from any research. So the next bit, have we got time to talk about safeguarding? A little bit. So the next bit is about safeguarding. So quickly, just talk you through this Every Child Matters. I've mentioned that policy already, but you probably all heard of Victoria Climbié. In 2002, she died in just before 2002, and the inquiry, the initiative was launched after she died. She was a 10-year-old girl who was tortured by her aunt and her partner, and she died. And after she died, there was a huge inquiry about, what led to her death, because she had about 18 to 20 different contacts with either health or social services in that time, and no one picked up on what was going on with this girl. So when she died, it led to a huge investigation and a huge change in the whole way in which sort of child protection was looked at. So Every Child Matters was this name of this document, policy, which then led to an update of the Children's Act, because prior to 2004, we were working on from the 1990s. And this document includes the care of all children up to the age of 19. And for those with disability, it's up to 24. Next slide, please. So the Victoria Climbié inquiry then led to this inquiry, as I mentioned, and Lord Laming made about 200 recommendations. But really, in essence, the main thing was this thing in bold at the bottom, that people just hadn't shared enough information. People, there were doctors who saw her or nurses who'd seen this girl. They'd worried about various things they'd seen. The social services had worried about different things. Perhaps the police had been involved one or two times with a very different thing, but no one talked to each other. And that was a big thing with safeguarding children and child protection, is that up until this inquiry, there wasn't any proper sort of accountability and sharing of information. So this is what changed after her death, and what led to the whole change in the whole child protection safeguarding policies. Next slide, please. So that's what led to the Children's Act in 2004. And so this now provides a legal basis for how social services and other agencies work together to deal with issues relating to children. So it's kind of led to guidelines for all individuals involved in looking after children, whether at home or at school, workplace, madrasa, anywhere, wherever we look after children. So, because we're all somehow, all of us, in one way or the other, involved with children, it does involve us. So we're all involved in safeguarding. Next. And I've said this one already before, but I just like that picture. This is a happy Muslim family. Be healthy, stay safe, enjoy and achieve, make a positive contribution, and achieve economic well-being. That every child has that right, and that's what this Every Child Matters policy is all about. Next slide, please. Next slide. So child protection. You all will have heard of child protection, protecting children from maltreatment. And safeguarding children is reaching beyond that. It's not just about child protection, not just about looking after, preventing them from maltreatment, but then allowing them to achieve their best. So allowing them to grow up in circumstances that are consistent with safe and effective care. So, and as I said before, it involves anyone in contact with children, so most of us. Next slide, please. So I just leave you read that, because whenever people talk about child abuse, people think it's just about either sexual abuse or being bruised or broken. But it isn't. Of course, physical abuse is what makes the headlines, because it's so shocking, because it leaves these scars. But it's not all obvious. Little things you might think are not so indicative of child abuse are like ignoring children's needs, putting them in unsupervised, dangerous positions, making them feel worthless or stupid, are also child abuse. Whatever the type, it all results in serious emotional harm. Next slide, please. again, my statistics. The figures are 50,000 children have a risk of being abused. So they have a child protection plan. But this is not the same as those who have been abused. It's very difficult to collect the data with regards to how many children have been abused. I can tell you that about 50 to 60 children a year in Britain are killed. Are killed by usually their parents or a close relative. That's the figures. It's high, isn't it? The NSPCC did a big study survey. About 2,000 children were asked questions, or in fact, young adults, and they retrospectively gave in this information that 25% were maltreated as children, and similar numbers were abused sexually. And out of that 25%, most of them didn't disclose this, so that no one said, they didn't say anything about it until this survey. Next, please. So these are the different types, and I've kind of alluded to these different types of child abuse. The physical, the sexual doesn't have to involve body contact, allowing children to watch inappropriate things on TV or internet, or allowing children to have access to pornography. That's also child abuse. Emotional, that's the one that probably goes a lot unnoticed, because, to some extent, all of us yell at our children. Hopefully, not all the time. This is what I'm talking about. Emotional abuse it's about constantly belittling them, shaming them, bullying them, and not showing them love and affection. So that's child abuse. And then neglect is another way. If I am expecting, for instance, a child to come to see me in clinic, and I know they have various issues. Maybe they've got a problem with their kidneys and they're waiting for a scan or something, and they don't come to my appointment, and they repeatedly don't come to appointments, keep offering them appointments, and the parents don't bring them. And I look and they say they're not taking the scans, they're not taking for their blood tests. That's neglect. So that's a different form of child abuse, because you're failing to meet your child's needs. It's not just about food and clothing, but medical treatment, hygiene, supervision. Next, please. It's almost namaz time, isn't it? It's salah time in a few minutes. Just to take you through, just very quickly, because I just wanted to just briefly talk on this. Myths regarding abuse. People think that abuse is only abuse if it's violent. It doesn't have to be violent, as we've just seen. There's all the different types of abuse, isn't it? It doesn't have to be abuse. Only bad people abuse their children. No, unfortunately, seemingly nice people do this to their children. Child abuse doesn't happen in good families. You can never tell. It can happen. People do this from all sorts of backgrounds. And I unfortunately I see that in my work. So you don't assume just because parents talk nicely or they're well spoken. Child abuse happens from social class 1 to 5. And the other thing that people think is something that happens is that abusers are all strangers, but they're not, unfortunately. Most children are abused by people they know. It's really sad, but it's true. Not all abused children will grow up to be abused, because they have a high risk. People who have been abused have a high risk of then abusing their children. But a lot of abused children will grow up to be, if they've been nurtured right and looked after right, then they will grow up to be normal people. So just wanted to mention those myths. If we can fast forward through the next slides, because I don't think we have time for that. Next again, and again, and again, and again. I think I alluded to this already. Children at risk of being abused. Unfortunately, disabled children, unfortunately, have a higher risk because they can't tell you. They can't tell anyone that people are doing things to them. Of course, parents with problems themselves, obviously, their children at higher risk. And then young, inexperienced children, where there is domestic violence at home, of course, that children are at risk. And moving on, next slide, please. And I just wanted to also just say, because we're all involved in looking after, we're all in contact with children, is that if you're ever worried about a child, you can always talk to someone and share your worries. If you're sure about something, you speak to the police or social services. If you're not sure, you can call NSPCC. They have a 24-hour line where you can pick up the phone and talk to them about it, and they'll advise you about what you should do next. Next, and I think this is my last slide, how to protect our children. So these are my own personal feelings about how we should protect our children. I think we should teach our children about what's, and I think as Muslims we do. We're very particular about teaching children about what's private and what isn't. But I think it's important to teach children to be really wise online, because our children are on the internet all the time now, aren't they? So it's really important that we teach them that bit as well, because they have access to people all the time through various chat rooms and things like that. The most important thing is to have open communication between parents and children. So if anything happens, they'll come and talk to you. They're not scared. Most children don't tell their parents because they're scared they won't believe them, because it's someone they know. And parents will say, how can so-and-so do that to you? If you have an open relationship with your children, I hope that they always will come and tell you. Don't put too much pressure on them. And I suppose, avoid being alone in a room with a teacher and a carer, and that's from the other aspect as well. As a teacher or a carer, you should try and avoid being alone in a room with a child. I see children with their parents, but if you go to see any doctor or nurse, most of them will have a chaperone with them if they need to examine you. You have to keep yourself safe as a professional dealing with children, and even as a teacher, even madrasa. You should avoid being alone, because you don't want to put yourself in that position. And stressed parents should seek help, of course. So finally, conclusions. The next slide. I've said all this already. The health of our children depends on supporting and optimising them. And of course, in the UK, the emphasis on supporting mental health and prevention of obesity. Asthma and allergy is a growing cause, and prevention is better than cure, which is hopefully I've spent a bit of time talking about prevention, and just that safeguarding is a duty that we all have. Okay, assalamu alaikum.
Okay, so we've got around 10 minutes for question answers. Any questions from the sisters' side?
Questions, yeah.
Thank you very much for that, Rumina. Did you find, are there any statistics to show that these problems are more prevalent according to the socio-economic categories?
What? Child abuse?
Generally child.
Just generally.
Child health and
child health. Yes, yeah. I didn't go into all the statistics, but yes, of course, a lot of the infections. I alluded to mental health being present different mental health problems that are present in different social classes, but all illnesses that might be related to poverty, uptake of immunizations, uptake of screening, uptake of antenatal care, they're all poorer in lower social classes. So yes, a lot of these illnesses are indirectly associated that way.
To the thing? Or we don't have?
There's no research, but I'm sure there is. Anyone want to do a study with me? But yes, that there are studies to do with, not with child health, but the power of prayer against on supporting people through illnesses, and there is evidence that prayer, but not just prayer, people's not just through spiritual sort of or religious faith, but people who have more of a family support and have a network of support through even non-religious support also find that they can cope better with illnesses and mental health issues.
Thank you for your talk. I thought it was excellent. From our immunology, we know that parasitic infection is accompanied by eosinophilia and high IgE. And migration of larvae can be manifested sometimes by an asthma. So I'm very interested in it's not yours, in the hypothesis and
Yes.
the hygiene hypothesis. And do you have the reference? I would like to have more details of that.
I can give you.
Yeah,
references.
because
There's
very
a lot-
interesting.
there's a-
You mean that to have parasitic infection might negate the development of
yeah.
asthma?
Yeah, or the develop of allergy. Yes, I mean, I can talk to you later. Everyone else might be bored about
Yeah,
T
yeah, no,
cells,
no,
but
I'm not
the T cells that I can either develop into T1, and T cells are the ones that produce antibodies. So T cells can either develop into T1 or T2. Now the T1s then stimulate the B cells to produce antibodies to fight infection. The T2s then stimulate B cells to produce IgE. IgE is the antibody that doesn't fight infection. It sees normal things as foreign, dust, pollen, whatever. And what's that balance? And there is a lot of evidence that if your T1 cells are not being active, then this is what's steering the T2, so the allergy. Yes, yeah.
Thank you very much for your talk. Question regarding seeing the screens, always looking at screens, other than the TV or especially computer, laptop. You say about just 1 and 2 hours, better not to be more.
That was,
So what
that was my
happened
opinion.
Yes, this is
But-
my
but- but
opinion.
that-
So
that-
it
there
is
are-
just for the children under 6, 8 years, or even for the children up to 14, 15 years,
Well, there isn't any, there is no research study, so I
Yes.
can't give you evidence. This is my opinion. But there has been at least 1 or 2 studies
Yes.
that have shown that excess, and that this is like over 6 hours
Yes.
of children who spend more than 6 hours on some sort of screen
Yes.
have more problems with communication,
eyes,
surprise, surprise,
yes.
social, communication and that sort of thing. But yeah, no, this 1 or 2 hours is my opinion.
Yes.
No, there's no research to
No
support my
research, yes, yes.
opinion. Yeah.
Okay. And regarding what you say, nutrition, for example, in my home, I buy everything. I have no problem in the buying or the finance or the economic problem. But when it's spring to come, it's the fruits and the other things, the protein. As what remain, my children, they don't eat it. Normally, they just want as you say, a glass of milk, or is this the best? But the mostly glass of the cola, that fortunately, recently they bring me the news that in French there is an institution say that is 10 milli was in each liters of the cola alcohol. So they told me that we shouldn't buy it. I say, yes, okay, it's up to you, better not to buy it. But normally they use some sweet and 1 glass of cola or milk, and that's all food, except just 1 time, perhaps in 24 hours, that to sit and to eat some kebab or something like this. This is the problem. So what should I can do for this, you think?
Yeah, teenagers are a different breed. I don't have teenagers yet, so I can't say. But when I think the important thing is to try and just establish good habits from when they're little. So, I can control what my kids eat because they're only 9 and 6, so they eat what I want them to eat. They're already developing habits. Layla doesn't like peas or corn, but she'll eat other vegetables. So, of course, children will develop likes and dislikes. But if you bring children up to certain foods, expose them to certain foods in their diet, and not expose them to the other stuff, then they grow up knowing a certain type of food. If you just don't keep the bad food in your house, then how will they eat it?
Thank you very much.
Medical journal that breastfed babies are less likely to develop allergies later in life. Is this true, and is there any other explanation you can add to this?
Well, breastfeeding, yes, it does. Children who are breastfed in longitudinal studies do have a lower risk of developing allergies. Lots of reasons to support that. One of the main reasons which they're trying to mimic in formula milk, they're always trying to make formula milk like breast milk, is the presence of this, what I mentioned, the prebiotics. Prebiotics are these, like a food substrate, it's a sugar. It's called an oligosaccharide. It's a type of a sugar that is present in breast milk. They're trying to mimic it, to put it in bottle milk as well. And prebiotics allow the diverse range of bacteria then to grow, because it's a balance of this, as I alluded to, this immunology, this T1, T2, let's encourage the T1 as opposed to the T2 that makes you allergic. So breast milk helps in those, but it's not just through these prebiotics. It's thought to be related to other good stuff that's present in it that helps this balance right. Not that every breastfed baby will not develop allergy, because it isn't, unfortunately, it isn't so straightforward. It's, if you take 1,000 babies who are breastfed and 1,000 babies who are bottle-fed, the breastfed babies will have a lower risk of developing. And that's the same with those other things I mentioned, those risk factors, Yes, if you take 1,000 moms who eat vegetables and fruits in pregnancy and have a good amount of vitamin D, then they will have a lower risk of developing. But because it's not just those factors, it's other things as well. It's your genetics, it's what you get exposed to. It's a multitude of things that play a part together that determine whether or not we don't understand all of those things yet.
Endorse your point about milk, and even within this community, 20 years ago, this was rampant. In fact, I remember a consultant, I think it was at Hillingdon, said that milk is for cows, not humans. So this is a problem within the Asian community, tremendous problem. Would you, I can see quite a few mothers and fathers here who either have got young children or are soon going to have children, inshallah, in the next 5 years or so. Would you actually encourage them to make sure that the children actually take supplements of not only iron, but vitamin D routinely amongst the Asian community?
It's a Department of Health recommendation that every child up to the age of 5 should have a vitamin D supplement. But drops, or in the young children, drops are easy. They're quite easy, cheap. 2 pounds a bottle you can buy, and it lasts you 2 months. But it's also a recommendation that all pregnant women, especially from ethnic minorities, should have vitamin D supplements. But it's one of these policies that's seeping its way through, but not everyone has it. But so yes, I would, especially breastfed babies, because after 6 months, if you're still on breast milk doesn't contain much vitamin D. Of course, the formula milks, they add it. So formula-fed babies are less likely to develop vitamin D deficiency. And actually, we're seeing a lot more rickets, which is a result of vitamin D deficiency. Usually always amongst darker-skinned people, because, as you know, but people who suffer with vitamin D deficiency are mostly darker people, because most of us get our vitamin D from the sun, yeah. And unfortunately, in this country, we don't get enough sun, do we? And then, those of us who do get a little bit of sun, some of us cover up our bodies more than others, so we get less exposure to sun. And then the darker you are, the more sun you need. So darker people, you need to spend more time in the sun because you've got more protection. So that's why, ethnic minority people are at higher risk, and that's why there's this drive to especially support the, pregnant women from ethnic minorities with vitamin D, but and also their children, because this is the high-risk population for developing rickets.
I just want to add that amongst adults, vitamin D deficiency is again rampant within the Asian and other community here. And for those of you who are sitting here who haven't had your vitamin D checked, I would strongly recommend you do so, because it's now linked with ischemic heart disease as well. So vitamin D deficiency is associated with ischemic heart disease as well.
More questions?
There's chickenpox. There's a debate going on. We don't do it in this country. They do it in Australia. They do it in America. No, we don't. Not routinely. It's not part of the normal. For those who have it, they have it done privately. It's not part of the normal immunization schedule in this country. As I said, they do in Australia and they do in America. I didn't get mine to immunize. I let them get chickenpox. There is some, chickenpox. It causes, people die from chickenpox still, and that's what supports the argument for a chickenpox vaccine, because not only do people die, but there's a high morbidity, a high illness associated with chickenpox, because some kids get really bad chickenpox, and if you're immune suppressed, if you get chickenpox, you can die. For those on chemotherapy or people who are suffering with cancer, or suffering with various immune deficiencies, if you get chickenpox, you can die. And the older you get, adults who get chickenpox suffer more. So yes, this is the case for we should immunize all our kids and therefore protect the whole society. But there is some evidence emerging. I mean, the reason why they don't do it in this country is cost, yeah. But there is some evidence emerging from the states where they've been immunizing their kids for a long time, is that yes, most people get protection from chickenpox, but then there are increasing number of adults who have been immunized, but then they're getting chickenpox later on in life, and they're getting really bad, because the protection you get from the immunization is not as good as getting wild chickenpox, normal chickenpox. So, the main issue here is the cost issue. That's why I think we spend £5 billion on obesity. Why can't we find money for chickenpox? But, it's a cost issue.
You've encouraged mothers to feed their youngsters with a protein diet. Besides meat and chicken, or maybe fish, what other sort of foods would young children eat which contain protein?
Protein, nuts, nuts and beans and dals. We don't use enough of them probably. So yes, yeah, there is vegetable protein. You need to eat more of it to get the same amount of protein, but there's a lot of vegetable protein. I think we ignore nuts a lot. Nuts have had a bad press because of this nut allergy business. Most of us are not allergic to nuts, so let's just eat them. Give your peanut butter is really good.
There are any more questions? I think we'll stop. Last question. Why do you think the UK has a higher infant mortality than the European?
That's an interesting question. There's lots of opinions about that. Some say because we have a higher migrant population than most of our European counterparts.
It's not really. France has a higher migrant population. Germany has a higher migrant population per capita.
Has it been broken down as to which ethnic groups
Yeah, no, I haven't. I know not.
France, North African migrants are relatively healthier than Indian subcontinent migrants.
In France.
No? I'm just trying to argue with Iqbal who said that
Yeah.
well, France, the North African migrants by and large.
They share the same bug.
Huh? Say it again.
Share the same bug. No, of course, we have a larger Asian origin migrant population.
Yeah.
They may have certain characteristics.
Well, yes. I mean,
but that will be only true if the mortality is very high in that particular ethnic group.
yeah.
I think this is what it shows from what I have seen is that it's across the board. The UK is worse. Although the health system is not that different from other places, so I can't really figure out what is the reason.
One of the other reasons actually is we have more premature babies in this country because and a lot of remember those figures I put up, a lot of that contributing to that 5%, 3% was a lot of them, yes, but also through IVF. A lot of babies born through IVF are born premature, so I think a lot of them are from there. So those are the ones been quoted as contributing to this higher rate that we have in Britain, the higher rate of prematurity and the ethnic group. Whether or not that's, I'm not an epidemiologist, so I don't know. But yeah, it's an interesting question. I think so I said we are 5.1% in Britain. And I think Germany and France are like 3.5%. Significantly different, yeah. All done?
Okay, thank you very much.